Question 221. When a client has peptic ulcer disease, the nurse would expect a priority intervention to be A. Assisting in inserting a Miller-Rabbit tube. B. Assisting in inserting an arterial pressure line. C. Inserting an esogastric tube. D. Inserting an IV. Question 221. Answer: C. Inserting an esogastric tube. Question 221. Explanation: a NANG tube insertion is the most appropriate intervention because it will determine the presence of active GI bleeding. A Miller-Rabbit tube, 1, is a weighted, mercury-filled balloon tube used to resolve bowel obstructions. There is no evidence of shock or fluid overload in the client, therefore, an arterial line, 2, is not appropriate at this time, and an 4 is optional. Question 222. The client with GERD complains of a chronic cough. The nurse understands that in a client with GERD this symptom may be indicative of which of the following conditions? A. Development of laryngeal cancer. B. Irritation of the esophagus. C. Esophageal scar tissue formation. D. Aspiration of gastric contents. Question 222. Answer: D. Aspiration of gastric contents. Question 222. Explanation: clients with GERD can develop pulmonary symptoms such as coughing, wheezing, and dyspnea that are caused by the aspiration of gastric contents. GERD does not predispose the client to the development of laryngeal cancer. Irritation of the esophagus and esophageal scar tissue formation can develop as a result of GERD. However, GERD is more likely to cause painful and difficult swallowing. Question 223. Which of the following dietary measures would be useful in preventing esophageal reflux? A. Eating small, frequent meals. B. Increasing fluid intake. C. Avoiding air swallowing with meals. D. Adding a bedtime snack to the dietary plan. Question 223. Answer: A. Eating small, frequent meals. Question 223. Explanation: esophageal reflux worsens when the stomach is overdistended with food. Therefore, an important measure is to eat small, frequent meals. Fluid intake should be decreased during meals to reduce abdominal distension. Avoiding air swallowing does not prevent esophageal reflux. Food intake in the evening should be strictly limited to reduce the incidence of nighttime reflux, so bedtime snacks are not recommended. Question 224. A client with peptic ulcer disease tells the nurse that he has black stools, which he has not reported to his physician. Based on this information, which nursing diagnosis would be appropriate for this client? A. Ineffective coping related to fear of diagnosis of chronic illness. B. Deficient knowledge related to unfamiliarity with significant signs and symptoms. C. Constipation related to decreased gastric motility. D. Imbalanced nutrition, less than body requirements due to gastric bleeding. Question 224. Answer: B. Deficient knowledge related to unfamiliarity with significant signs and symptoms. Question 224. Explanation: black, tarry stools are an important warning sign of bleeding in peptic ulcer disease. Digested blood in the stomach causes it to be black. The odor of the stool is very stinky. Clients with peptic ulcer disease should be instructed to report the incidence of black stools promptly to their physician. Question 225. The client with a duodenal ulcer may exhibit which of the following findings on assessment? A. Hematemesis. B. Malnourishment. C. Melena. D. Pain with eating. Question 225. Answer: C. Melena. Question 225. Explanation: the client with a duodenal ulcer may have bleeding at the ulcer site, which shows up as melena, black tarry poop. The other findings are consistent with a gastric ulcer. Question 226. The nurse provides medication instructions to a client with peptic ulcer disease. Which statement, if made by the client, indicates the best understanding of the medication therapy? A. The cimetidine, Tagamet, will cause me to produce less stomach acid. B. Sucralfate, Carafate, will change the fluid in my stomach. C. Antacids will coat my stomach. D. Omeprazole, Prilosec, will coat the ulcer and help it heal. Question 226 Answer: the cimetidine, Tagamet, will cause me to produce less stomach acid. Question 226 Explanation: cimetidine, Tagamet, a histamine H2 receptor antagonist, will decrease the secretion of gastric acid. Sucralfate, Carafate, promotes healing by coating the ulcer. Antacids neutralize acid in the stomach. Omeprazole, Prilosec, inhibits gastric acid secretion. Question 227. When obtaining a nursing history on a client with a suspected gastric ulcer, which signs and symptoms would the nurse expect to see? Select all that apply. A. Epigastric pain at night. B. Relief of epigastric pain after eating. C. Vomiting. D. Weight loss. Question 227 Answer: C. Vomiting. D. Weight loss. Question 227 Explanation: Vomiting and weight loss are common with gastric ulcers. Clients with a gastric ulcer are most likely to complain of a burning epigastric pain that occurs about 1 hour after eating. Eating frequently aggravates the pain. Clients with duodenal ulcers are more likely to complain about pain that occurs during the night and is frequently relieved by eating. Question 228. Which of the following factors should be the main focus of nursing management for a client hospitalized for cholecystitis? A. Administration of antibiotics. B. Assessment for complications. C. Preparation for lithotripsy. D. Preparation for surgery. Question 228 Answer: B. Assessment for complications. Question 228 Explanation: The client with acute cholecystitis should first be monitored for perforation, fever, abscess, fistula, and sepsis. After assessment, antibiotics will be administered to reduce the infection. Lithotripsy is used only for a small percentage of clients. Surgery is usually done after the acute infection has subsided. Question 229. After a subtotal gastrectomy, care of the client's nasogastric tube and drainage system should include which of the following nursing interventions? A. Irrigate the tube with 30 ml of sterile water every hour, if needed. B. Reposition the tube if it is not draining well. C. Monitor the client for N.V. and abdominal distension. D. Turn the machine to high suction if the drainage is sluggish on low suction. Question 229 Answer: C. Monitor the client for N.V. and abdominal distension. Question 229 Explanation: Nausea, vomiting, or abdominal distension indicated that gas and secretions are accumulating within the gastric pouch due to impaired peristalsis or edema at the operative site and may indicate that the drainage system is not working properly. Saline solution is used to irrigate nasogastric tubes. Hypotonic solutions such as water increase electrolyte loss. In addition, a physician's order is needed to irrigate the ENG tube, because this procedure could disrupt the suture line. After gastric surgery, only the surgeon repositions the ENG tube because of the danger of rupturing or dislodging the suture line. The amount of suction varies with the type of tube used and is ordered by the physician. High suction may create too much tension on the gastric suture line. Question 230. A client being treated for chronic cholecystitis should be given which of the following instructions? A. Increase rest. B. Avoid antacids. C. Increase protein in diet. D. Use anticholinergics as prescribed. Question 230 Answer: D. Use anticholinergics as prescribed. Question 230 Explanation: Conservative therapy for chronic cholecystitis includes weight reduction by increasing physical activity, a low-fat diet, antacid used to treat dyspepsia, and anticholinergic used to relax smooth muscles and reduce ductal tone and spasm, thereby reducing pain.